Planks are arguably one of the most common exercises in any movement profession. We have physical therapists that use it to get people out of pain, and then we have personal trainers that use it to get people stronger. So yes, it's a great exercise, but because it's so common, there tends to be a lot of problems along the way. So in this video, I want to share 3 myths and debunk them so that we can understand how to maximize our performance when it comes to a plank and make sure that we truly get our patients out of pain. Myth number 1, planks are an abdominal exercise. So yes, they technically are an ab exercise because you're feeling it, right? But the main point here is that it's not truly an abdominal exercise. It's a positional exercise. Once we can teach our patients that it's a positional exercise and not an abdominal exercise, we can start to focus on the right thing. While someone is going through a plank, we're trying to emphasize that they need to hold a very specific position. The result of holding that position is they will feel their abs like they've never felt before. But when we just label it as an abdominal exercise, our form tends to get sloppy. So the position that I'm talking about is that we need to be able to go in a position where we have enough protraction and we have enough of a posterior pelvic tilt to actually get the abs to contract. When we think about being just an abdominal exercise, form goes out the window, patients hold it for as long as they can, they may or may not feel their abs. So educate your patients that it's a positional exercise, not an abdominal exercise. Myth number 2, hold for X amount of time. So what we should strive to do here is remove the language of time and instead replace it with breaths. In this position, such as a plank, the abs are working, right? We know that, and specifically when we're in a good position, they're working. But what we also can do is add in the respiration. Why? Because when we breathe, specifically exhale, the abs contract. So now we're linking up the pelvis with the rib cage. This is how we truly start to take our plank to the next level, not from just working the abs more, but starting to change a person's pattern. When we can change their pattern, that's when the plank becomes super powerful. So instead, replace hold with 60 seconds to hold for 4 breaths. Myth number 3, going into a plank position and just holding. Instead of just holding, we really want to educate our patients that we are trying to fight a particular pattern. As they're holding here, each second they're holding, they're going into more and more extension. And so a lot of patients just go into this, there's not a lot of thought through it, and they hold it, and then they start falling into extension, and then their back hurts, and they're not feeling their abs, and we're missing the point of the exercise. So instead, as they're up there, we need to educate them that they need to be continuously holding on to a certain position. And we can do it with the following cues. When they're in this position, we need them to have their chest up, and we need to have them pushing the belly button up as they push their hips down. Notice how I'm getting more rounded. Also notice how the abs start to shake more and more. This is the position that we're ultimately trying to get them to hold on to. Myth number 4, a plank should look straight. So anytime that you watch someone plank, they're usually pretty straight. But the thing is, we actually want them to be relatively rounded. Why? Because we want them to have the rib cage in a protracted position, and we want the pelvis to be in a posterior pelvic tilt. Both of these are going to round the thoracic spine and round the pelvis, right? And so we just kind of talked about this. But while we're going through this, we need to educate the patient that it's okay to be rounded. So many people think that they have to be straight. So we have to get them familiar with the idea that it's okay to be rounded. And how you can really get that is you can have them start to push through the elbows to get the chest up, tuck the tailbone, and be in this rounded high position, and then start to slowly lower it until they really feel their abs. But again, the patient should look relatively rounded, not straight. So those are my top myths that I see. I hope you find that valuable and start to change some of the myths and start to help your patient really maximize their planks. Now, here's a quick little bonus, and that is how we can coach it in 4 simple steps. If they can follow these 4 steps in conjunction with the myths that we just talked about, they should have no problem really progressing in a plank. So those steps are as follows. Once they go in this position, we make sure they don't go clasped hands, we keep them straight. Then we go head down, chest up, belly button up, tuck the tailbone under the belly button. Then we have our 4 breaths. Notice how each step is bringing us through exactly what we're looking to do, which is more of that thoracic protraction and the pelvis going into more of a posterior pelvic tilt.